How does your bladder function? The bladder is an amazing organ that plays a key role in how we manage waste. It is a hollow, muscular structure that acts as a storage tank for urine until we are ready to release it. Urine is created in the kidneys, then it travels down to tubes called ureters and enters the bladder. This happens at a spot known as the ureter-rovesical junction. As urine fills the bladder, its elastic walls stretch. These walls are mainly made up of a muscle called the detrusor muscle. The bladder can typically hold between 400 to 600 milliliters of urine before it sends signals to the brain that it's time to go. Inside the bladder, there are folds called rugae. These folds help the bladder expand without raising the pressure too much inside. As the bladder fills, stretch receptors in the bladder will detect the increase in volume. These receptors send signals to the brain when the bladder reaches a certain fullness. This communication involves sensory nerves that sense the bladder stretching and autonomic nerves that control the bladder muscles. To keep urine from leaking while the bladder fills, the internal urethral sphincter, which is made of smooth muscle, stays contracted. The external urethral sphincter, made of striated muscle, is under our control, allowing us to decide when to urinate. When it's time to go, the brain coordinates a response. The detrusor muscle contracts to push urine out, the internal urethral sphincter relaxes, and we consciously open the external urethral sphincter to let the urine flow through the urethra and out of the body. This entire process is managed by a balance of signals from the sympathetic and parasympathetic nervous systems. The sympathetic nerves help keep the bladder filled by relaxing the detrusor muscle and tightening the bladder outlet. In contrast, the parasympathetic nerves kick in to stimulate the detrusor muscle when it's time to empty the bladder. Understanding how the bladder works is crucial for maintaining bladder health. Problems with nerve signals or muscle function can lead to issues like incontinence or urinary retention. Additionally, changes in the bladder wall or lining, such as those seen in bladder cancer, can disrupt normal function. Keeping the bladder healthy means ensuring the muscles, nerves, and lining are in good shape and being aware of any symptoms that could indicate a problem, including cancer. In essence, the bladder is a dynamic organ that stores urine and releases it when we choose, thanks to a well-coordinated system of muscles and nerves. Understanding this process helps us appreciate the importance of bladder health and the potential impact of various conditions. Always consult a healthcare professional for personalized advice regarding bladder health.